But just as a general sum up, we always say this, with another massage tip for massage professionals. Today we're going to be discussing the difference between sports massage and regular massage. You're going to get this question all the time. I get it every single day. Our office receives calls, and it might be because out on our sign on our property it says sports massage. So people are very inquisitive. So when a patient gives you a call and asks what is sports massage or what's the difference between that or deep tissue, how do you answer? What do you say? Well, I wrote an 1,800-word article on my website, hollandreflexology.com, to answer that. But for those that don't want to read all that, I went ahead and decided to make a video. So what I find the best way to answer the question is to ask the patient, how do you define a regular massage? What is your experience with that? And they'll talk to you about, well, there's nice superficial strokes on their skin. They might do some kneading back and forth. They focus on their neck and shoulders with this nice rubbing motion. They spread oil over the body or lotion. Sometimes they might even have specialties such as stone massage, hot stone, or things like that. Then they'll define deep tissue as, but I like a little bit more pressure. I like that deeper pressure, but again, it's still the same strokes. There's really no difference. It's just squeezing harder in the petrissage or pushing deeper in the effleurage of the strokes themselves. So once they say that, then I say, well, that is correct. A regular massage is a general massage. So a regular massage equals a general massage. Sports massage equals being specific, very specific, especially with the needs when it comes to athletes. Even though this doesn't equate just to athletes, we have people that play sports on the weekends, we have construction workers or people that work very, very hard in life, and they may have sports-like injuries, or they might have sports-like concern of issues that might be coming. They too might request a sports massage. So how would we go about doing a sports massage? Well, before we get into that, let's talk about the history of it. Sports massage has been around since the beginning of sports, right? But it became mainstream in 1984 at the Summer Olympics in Los Angeles. It was started recognized by the medical community as a true modality, a legitimate modality that could help the athletes. And what they did is they set up 3 stages of massage. A pre-sport massage. So before they actually got into the event, pre-event, they would get a very vigorous massage. It'd be a lot of shaking and jostling of the legs and the arms, a lot of very, very, very quick stretching, no static stretching whatsoever, but a lot of vigorous blood flow, just getting the adrenaline going in the body, getting that athlete prepared, just kind of loosening everything up so they get out on their field and do whatever their sport is. And then there's an intra, so between the events, they would have maybe something specific that they were looking at being worked on, saying, hey, I'm starting to get a Charlie horse in the back of my leg. Then the massage therapist would direct all of his attention just to that. But there was no relaxation included in that massage. And then after the events, after the day has ended, there would be a restorative massage. Now that's what we do in our office. We don't go to the event sites. The athletes come to me here and they're looking for that rehabilitative feeling, getting that body back in shape. So what would be an example of a sports massage? Well, maybe we have a baseball player that comes in here and they threw the entire game. Well, what are you going to be focusing on? You're going to be focusing on that arm, right? And you might spend the entire treatment just working on that one body part alone. And you're digging into the most little minute. You're looking for tiny trigger points. You're looking for articulation in those joints to be as perfect as they could be. You're looking for edema. You're looking for swelling. You're looking for muscles that are hypertonic. You're looking for things that will prevent them from having injury in a future game and also bring them relief right now. So just an example, let's say a person plays soccer. we're going to be looking a lot at their knees and shins, right? So we might take that knee and we might articulate the knee in a way that we would never do during a deep massage treatment. We're going to be looking at the PCL, the ACL, the collateral ligaments. We're going to be looking at joint function in the ankle. We're going to make sure the navicular bone is lined up properly over that calcaneus. We're going to be looking for any kind of bruising in the toes, around the ankles, and then we're going to work out any edema or any kind of issues that might be in the foot itself. So there's going to be a lot of stretching. People are quite surprised when they get a sports massage how much stretching is involved. That's why we have an underwear or shorts requirement in here, because we might take their knee and bring it as close to their chin as possible. Or we might cross their legs over, or we might pull their arm all the way around the back side of their head. You know, we are going to put them in almost like yoga positions as we stretch their body and try to find out what is tight, what is not tight, what needs to be helped. We're also going to be doing a lot of compression movements, because ischemia, ischemic tissue in particular, that means there's a lack of blood flow in that tissue. Could have been from trauma, them getting hit or something. Maybe they're a football player. I remember when I played football and I'd get hit, you could get, you know, deep contusions or bruises, and a lot of times you wouldn't get blood flow in that area. So we'll use compression to bring blood flow back in there. It looks kind of something like this, and it's pretty fast, but we'll compress, 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 almost like you're doing CPR on somebody, but you're trying to pump and draw blood into that muscle group. Now athletes have this done, and so they can withstand the pain. But the general public, you bring them in here and you do that to them, you probably won't see them again. But that's just one example. Doing ischemic compression really can make a difference in bringing hyperemia back in, getting that blood flow of what the particular athlete needs. And there's a whole lot more to it than that. But just as a general sum up, we always say this: regular massage, even deep tissue included in that, is a general massage. Sport is specific. And hopefully that answers that for them. And sometimes I'll just give them a little teaser about what sports massage is like during a deep tissue treatment, because they are inquisitive, and I'll give them a quick little example on that. They're like, oh, okay, that was great, thanks a lot, but I don't need to have that done ever again, right?